Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I have a very different topic for discussion, something that is quite aimed towards precision medicine. Now, I will be talking to all of you about pharmacogenomics and how, in today's world, it is becoming an integral part of precision medicine. Nowadays, if I have to talk about it, modern medications and treatments, we all know, save millions of lives every year. Now, so the aim of this precision medicine is basically to tailor healthcare with decisions and treatments often customized to each patient, or rather everyone, in every possible way. So it answers to the question of how an individual's genetic background is associated with either drug resistance or therapeutic failure or even adverse drug reactions, and how this therapy strategy can actually be modified for a certain person to achieve various benefits. So, to give us more insights into this precision medicine, into pharmacogenomics, we have with us today Mr. Amol Naikawadi, who is the Joint Managing Director at Indus Health Plus. Welcome to Medical Dialogue, sir. We are really happy to have you on board here with us today.
Thank you, Dr. Nandita. It's a pleasure to interact with you and through you to your viewers, where we can have this interesting dialogue of an interesting field which is coming up in globally and also in India.
Great, sir. So, sir, if you're talking about this, if you can briefly explain to us what is pharmacogenomics and how is it helping in effective treatment?
Yeah, so certainly. So pharmacogenomics, like all of us know, genomics is playing a very important role in the entire healthcare space because genetically all of us are unique and all of us are different and unique. So similarly, so pharmacogenomics is a science where you are trying to address two things simultaneously. The science of medicine or pharmacy, and on the other side, the genomics part. So when we are saying that everybody is genetically unique, so in that sense, the requirements of healthcare or medicine are more personalized. So what happens is when a medicine comes out after a research or something, it is tried on a certain set of population, but not on every person. So what happens is the medication which is available may not be effective on all the people in the same way. And that is the science of pharmacogenomics, because everybody would respond to a medicine, or how he will, how the medicine would get absorbed in his body is different based on his genetics. So typically when a doctor gives us a medicine, he's aware of our he has made a diagnosis based on the blood reports or other diagnostic reports which are in front of him. He knows our gender, he knows our age, he knows other associated risks which we have, and based on that he makes a diagnosis and goes ahead with recommending a medication. But the only thing which he doesn't know, that how is our body going to respond to that medication? Are we going to have some side effects or adverse drug reactions to that? So that's the reason typically what happens is doctors tells us that we will prescribe you this medicine, start with this, meet me after 10 days, 15 days, month or 3 months after a particular protocol is followed, and we will see how you have been responding, and based on that we will continue or make the changes. Because like I said earlier, what they're not aware is how would my or an individual person's body respond to that. So when we are saying a pharmacogenomics, here it is a science which exactly answers this question, that how a person's body would respond to a medicine, and that to particular medicine, because there are international bodies like CPIC, PharmGKB and other things. So these are international research consortiums who have created a database of research data based on a lot of medicines, where based on that there is a clear-cut actionability that we are able to recommend that whether the same drug has to be recommended, continue to be used, or there you need to make some changes in the dosage, or you have to avoid a particular drug, or sometimes you are also able to tell them that if you continue using that drug, whether there will be any adverse drug reactions. So this science is called pharmacogenomics, where we are able to help a person understand which is the right medication and which is the right dosage for a person. Dr. Nandita, I hope I have been able to answer your question.
Yes, perfectly. I think it's a science that basically, as you mentioned and as we were speaking about it, it's confined to each person. Each person's genetic profile is different. So how the drug actually reacts with every
Yes.
person, that is what the science that we're talking about today. So
Correct.
if you're talking about this in a little bit of detail, if you can just explain to us how pharmacogenomics actually works in practice.
Yeah, sure. So globally, it has attended a lot of importance. So a lot of global healthcare service providers, like right from Mayo Clinic to other places, have introduced personalized medicine department in their place. So in NHS UK also is implementing that kind of a science, because they have done a lot of work in genomics, and so at a lot of places they are implementing for different population. They uh, more like a preventive study of pharmacogenomics, so that people have that report ready whenever the medication is being recommended to them. There have been some areas in Qatar, a lot of work has been done in pharmacogenomics. So both at it, maybe at a hospital level it is implemented, at a country level or a larger healthcare ecosystem level it has been implemented. Like Taiwan has done a lot of work in that. Like I was saying, Netherlands has something called PGX passport for its population. So different people, like Colorado state healthcare system offers that for everybody who comes for any kind of a healthcare requirement, has been given a choice that they can genotype their genes, and based on that they will get this recommendation, so that at that time or in future they will be recommended a right medicine, and not the medicine which they are not suitable for. So even in India now, a couple of doctors, specifically this science is more utilized right now in three areas, is where we are seeing a lot of difference. One is oncologist, because they were always aware, because genomics has played a very important role in that field, about how these kind of personalized medicine plays a role. So they have been the early adopters. Other than that, there are early adopters have been in the areas of psychiatry or mental health. One, because the awareness about mental health has been largely increasing. Unfortunately, what happens is, by the time a doctor and a patient is able to identify which is the most suitable medication for that person, it takes a lot of time of trial and errors. So what pharmacogenomics really helps in avoiding these trial and errors, because you already know that what will work and what will not work, what dosage would work. So that really helps them in that area. So they are able to identify medication which would work with them at the shortest span of time. So even the cost of treatment goes down, effectiveness increases. So that is an area where it is being used. The other area where it is being largely again used is in cardiology, because the number of people having cardiology issues, and after a particular age group, a decent population or percentage of population has either a hypertension or cholesterol or triglyceride issues, specifically in India also. And that's the reason the medication which they have been put on. So the cardiologists are also among the early adopters. So what they're doing is, either at that stage, so all these specialists are using this at both the stages. One, at a stage when they want to prescribe a medicine. So at that stage, they are asking people to go for their patients to do this test along with the other bunch of tests which we talk about, to come to the diagnosis, what is the exact disease. So that time they are recommending. In some cases, we are seeing a lot of proactive work being done by healthcare institutions and doctors, where they're encouraging people, though at that point he may be on a medication or not, but on a preemptive setting they are encouraging people to get these reports done and keep it handy, more or less in a very layman terms, like I know my allergies well, or I know my blood groups well. Not that I'm going to need it every day, but at right time I should have that information handy, which will help me and people who are going to treat me. So similarly, a lot of people have taken this view that this information should be available in a preemptive setting with me. So whenever the opportunity in a normal condition or in an emergency condition comes to prescribe a medication, I can avoid trial and errors and recommend a medicine or prescribe a medicine which is the most suitable for that person. So these are the settings where we are seeing the maximum usage.
That's very great. As you mentioned, these are the three pioneer branches in medical practice where one actually needs to go down to understand the genomic typing or the genome genetic testing of an individual to actually further go ahead with the medicine prescription. So, what are all the categories and parameters that can be included in this genetic testing?
So, overall in the genetic testing, if I talk about, if the question is more about other than pharmacogenomics, what all genetic testing can help. So, the areas it can help, it can tell you your predisposition to a lot of health conditions, because like all of us know in a very plain vanilla words what is my family history, but what has really been passed on to us, we can find out, because at the end whatever is our health as on a day is a typical combination of the genetics which we were passed on to us from our parents and the lifestyle we lead, so that decides our health as on a particular day. So there are a lot of health reports can be generated based on that, where they can tell us what is our predisposition to multiple health conditions. Similarly, it can also tell you about your tendencies. Like if we say, take an example, when a doctor recommends you a few things that you should look at a particular diet or eat more healthy or add physical activity, so or either a walk or a gym. So a lot of times people are confused that what will work with them. So to some extent, genomics also answers this question that what is my body tendency. Because if we see that all diets and all fitness activities don't give the same results to same set of people, because again I'm coming back to the same thing, because all of us are genetically unique. So if the science can help me to tell me that what activity I would respond faster or what is my tendency, so even those kind of reports can be given about nutrition, about fitness parameters, so that can be given. They can also tell also about how would my body respond to exercise in case of an LDL or an HDL, or for a blood pressure, how it would respond to. So because a lot of research has been done in this area, like we discussed some time back in genomics, and how this unique information can add value. So all these reports are now available globally, and also largely been available, and people are aware about awareness is building in this category specifically.
Great. So, again, if we are talking about genetic testing and how it is improving in the field of healthcare, and so, what is your say in how it can help in disease prevention? What effect will it show in case of a preventive aspect?
Yeah, so actually genomics can play a very important role in prevention if we decide to do it in a preemptive settings. Like we discussed some time back, imagine I already have an information at a particular age that this is the genetic code which has been passed on to me, or this is a predisposition which I have, or this is a tendency which I have for different health conditions, whether it's a cardiac thing or a diabetes or a hypertension, or sometimes vitamin deficiencies like vitamin D, B12. If I know that information well before, then I can modify my lifestyle accordingly and take preventive measures based on that. Because as we all know that if we have a knowledge or insights, then science has also developed on the other side where I can take actions, or in a lot of cases lifestyle modification itself will play a role. Because a lot of times, let us take an in case of a diabetes, for I need not really wait that one day I would go for a preventive screening and I should be detected of a diabetes, or I need to fall somewhere, or my blood sugar need to drop to that level, and I should start acting on it post that. This is not the preventive science. This is more like a curative kind of a thing where you are waiting for a problem to happen and then trying to repair your body onto it. On the other side, imagine if I at a particular age, maybe in my early 20s, I already know that unfortunately I have a genetic tendency for a diabetes. So I will take preventive measures accordingly to add physical activity in my thing. I'll reduce the sugar content accordingly. I would try to also measure my diabetes at a regular interval, because now I know there is a risk. So I'm taking preventive measures. I'm also trying to diagnose it at an early stage. Now this can apply to any kind of an health condition where I already know these insights. In fact, genomics can play a very important role as a preventive measure. Like we discussed, even the first part, pharmacogenomics. So imagine I already have this information with me, maybe a report or a report in my mobile app as an individual. I imagine my doctor also, or family doctor, or a healthcare system where I go and usually access healthcare, have that information ready with them. So whenever I need to be prescribed any medication in a normal condition, maybe next year, after 5 years, or after 10 years, or in the emergency situation, I have to access some healthcare, or somebody has to administer an anesthesiology drug because I have to be given anesthesia for a particular treatment post that, and that information is available to me and my treating doctor well in time. So all these things, so adverse reactions, drug reactions can be avoided, but treatment would be more effective, cost of treatment would go down. So if you see, all these are multiple benefits of knowing your genetic information, or I would say genetic insights well in time. Like when I usually also give an example that in today's world we have got used to Google Maps and other things. We want to travel from one place to another, and if we know that this is the time I'm going to take, whether there's a traffic jam, no traffic jam, there are alternatives to the road, then when I have these insights, I am actually handling a situation in a much better way. I don't have to go through a chaos. I don't have to panic at a situation that what has happened, or I'm going to be late for a meeting, because these insights are available. Now imagine a small traffic which we are talking about, and now here we are talking about our own health, which is the most precious asset. And if we have more insights already with us, so whether it's we as an individual, whether it's our fitness trainer who is going to use this to guide me a better activity, or my dietitian, or my doctor, all of them have these insights. They can always help me to lead a more healthier and happier life. That is how it helps.
That's a wonderful example that you gave. So as you mentioned, if we are heading out somewhere, Google Maps helps us and gives us, so our mind is actually prepared to
Correct.
what we're going to face ahead, right? So in the
Yes.
same way, as we are going to deal with our own health, that is more important to us and to nobody else. So definitely it will be much better if we are prepared about it well in advance, rather than to wait right at the end and then go ahead with complications and adverse drug reactions. That's
Correct.
definitely a very good classical example that you explained. So what do you think will be the future of genetic testing in India?
Yeah. So if you see globally, what has happened is the best part, though, as all of us know, the first genome was decoded in early 2000. So it's been hardly 20 years the first time a genome was decoded in the entirety. So it took a huge amount of cost when it was done. But the good part is, with the advancement of science, the cost has drastically gone down on the one side. Awareness and affordability has increased. So because of which, in the global markets or global countries, we are seeing as developing countries, a huge amount of people are using genetic or genomic information in healthcare, both in preventive and curative settings, to treat themselves, or doctors or clinicians are using it to treat the patient in a much better way. And that is the same trend which is expected right now in India. One, because the cost of doing a genome analysis is going down and expected to go down over next 10 years, further from where it is right now. Otherwise, a normal person even today would not have been able to afford at what rate the rates which used to cost to decode a genome because it costed almost $1 billion 20 years back. So the cost is going down. Second, lot of research is being done globally because everybody understands that the era is all about a personalized medicine. Everybody will fit into one thing is not the way healthcare is going to look at people and patients over a longer period of time. So when there is a lot of genomic research is happening, it is going to aid in both in awareness, and that research is going to be available for the benefit of population. So we are seeing, like example, even genomic analysis, and there have been countries like US where more than 15% of the or 20% of the population has already done some genomic test or in past 10 years already. So you will see a similar kind of trends both in India and in all the developing countries, that the genomics will play a very important role both in preventive healthcare and the treatment areas, because the era is moving towards personalized medicine.
Great. So the future we are looking at can be a very bright one indeed.
Yes, certainly.
So talking about the future, what do you think is the future outlook of Indus Health Plus in the field of preventive healthcare as well as genetics?
Yeah. So if you see overall, everybody has started valuing their own and family's health the most, specifically after the COVID, because everybody has realized the most precious thing is their own health and their family's health. And everybody also understand, unfortunately, I would say that COVID, but an important part COVID did is created awareness to all of us that prevention is the best way to treat any kind of a healthcare situation. So with that, what we are seeing a huge number of people coming forward to look at healthcare in a more positive way, or I would say in a prevention and wellness way, than in a sick care or a curative settings. So because everybody wants to have healthier lives for themselves and their families. Entire India, in general, if you see in last 5-10 years, has become more ambitious. They want to have more prosperity. They want to achieve goals for themselves, their family, their country. And while doing that, the awareness has built up that they don't want any hurdles to come because of healthcare issues, which can be tackled in a much better way. The awareness is also building on that the cost of treatment is much higher than the cost of prevention, because cost of prevention would lot of times it would be hardly 10% of the cost of treatment. Forget the cost of lost lives or other complications which the entire family has to go through. So that awareness overall about preventive healthcare is building up, and that's the reason we are seeing a huge growth over next 10 years in the entire preventive sector, where Indus has been focusing for last 2 decades and is one of the pioneers in the field of preventive healthcare. So what we are seeing is both on one side that more and more people are coming forward for high-end diagnostic screening tests, again to know what is the status of their health as on a particular day. A huge number of people we are seeing. And earlier, if you see pre-COVID, we used to say a more trend where typically only an individual would come to do the test. So our assumption that time was more the bread earner who was only coming for these kind of screening. But post-COVID, what change which we are seeing is it's typically either husband, wife, or entire family with their parents, or all of them coming together for these kind of preventive screening programs. And people are asking us more that what else can we do? What are the other tests which we can do for cardiac, cancers, and other things which will help us to identify the problems at an earlier stage. So we were among our pioneers also in the area of offering more comprehensive diagnostic tests in a preventive screening, but people are still coming up and say, is there next technology which can also help me to detect a problem at a much earlier stage? So those kind of changes which we are seeing. Similarly, we are seeing, which we have discussed a lot today about the genomics, because again, COVID played a very important role in creating awareness about genetic, genomic, sequencing. Those technologies played a very important role right in identifying the virus and its different versions, as we all went through that phase, and we also know that genome sequencing played also in a role in helping to come with a vaccination, because the inputs are also used for. So genetics, genomics, which were not in common man's dictionary prior to COVID, suddenly during this phase, all of these things really reached out to people, and people now understand genetics, genome testing, how it can help. Only thing, we have to guide them to choose the right package based on what kind of goal they have, or what kind of things they are looking at, or what kind of age group they fit into. So that is where we are seeing our role, and we are seeing, because of this huge awareness both on preventive and wellness and on genomics, that next 10 years it is going to be a phenomenal growth for Indus. So already we have multiple products in this category, offering different things in the preventive area for different population and gender. We are also partnering with some companies where we can help them with the IP which we have developed in the genomic space. So there have been some organizations in the neighboring markets where we are helping them with analysis and reporting. So we are seeing growth where across India, where we will go out and educate people and help them choose a right preventive program, which would be a combination of preventive diagnostic tests and genomic tests, again with a clear idea that through both these things they will have more insights about their own health, more data points in the today's world about themselves. That on one side, and on the other side, we are seeing a lot of things where people are looking forward to partner with organizations like us, where we have developed an IP, and thanks to technology now we can help a genomic company in another country also with the reporting and analysis. So on both these sides we are seeing a huge opportunities for growth.
Great. That's a wonderful takeaway message, Mr. Amol. Thank you so much for joining us today. Thank you for all your valuable insights and joining us at Medical Dialogues today. Thank you so much.
Thank you, Dr. Nandita, and it was a pleasure talking to you and through you to all your viewers. Thank you and wish you all the best.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.